far we have a total of 174 programs, of which 122 are neonates and 27 are children out of the perioperative group, and the last 25 are the fetal group. And so the question is why? Julia touched on this a little bit, but why do we participate in dream study? What is the point of our study? And I think that there's two sort of philosophies or two big picture reasons for any sort of genetic study on what we believe is a congenital abnormality. The first is, will it, to some degree, help us with some sort of a prenatal intervention? And many of you probably, either when you were pregnant or afterwards, since you've had a child, heard about fetal surgery or tracheal ligation or something like that for diaphragmatic hernia. The history of that started back in the 80s out in San Francisco, where they thought they could operate on a fetus that had a diaphragmatic hernia and take all the intestines and everything out of the chest, and so the diaphragm was bent, that maybe the child would grow a little bit better in utero, and that they would have a better survival afterwards. And it was an interesting concept, and it was a very really sort of thinking out of the box at the time. The unfortunate part is that it didn't seem to help, and that's probably because by the time you operate on a fetus, on an embryo, the damage has already been done. The lung injury is already there, the lung is not going to go. It's not something you can change that late on in life, and that sort of echoes the findings that pediatric surgeons have seen over the last 50 years in general. We used to, when I was a trainee 10 years ago, I used to hear my attendings speak about how when the diaphragmatic hernia was born, they had to rush this kid to the operating room and fix it right away because they thought that everything was pushing on the lungs, and so you had to take everything out of it. We know now that that's not at all. It doesn't matter when you operate, but the lung injury or the lung damage or the lung problem has been there for a long time. Whether you reduce the hernia or not, it doesn't matter so much. What matters is giving the child the right postnatal therapy so that their lungs can develop the best they can. So although prenatal intervention right now hasn't shown any positive outcomes, what has emerged from all this prenatal intervention stuff is that there is now a growing field of gene therapy or prenatal therapy. So even though we can't, or operating on a fetus may not provide any long-term benefit, right now there's something called gene therapy where you can somehow affect the gene while the child is growing. The first step to affecting the gene is identifying if the gene is either there or absent, or whatever the genetic abnormality that Julie spoke about is there. That's also quite early. There's very little being done actually in clinical practice in gene therapy. I think that though that's something that we have to keep a big picture down the road. So then what is the longer or rather the shorter term consequence of participating in studies? Mostly, as Julia mentioned, prenatal counseling. If we can identify fetuses with CDH, or perhaps more importantly, or just as important, fetuses that we understand might have a harder time after they're born with CDH. This will help the parent both with their prenatal decision making as well as to help them understand what's going to happen next. And this is just a slide that was from a paper published about 6 years ago looking at something called pulmonary hypertension. Probably everybody knows what this is, but a quick overview. Hypertension means high blood pressure. Pulmonary hypertension means that there's high blood pressure in your lungs and going into your lungs. In other words, the rest of your body is, when we think of hypertension and high blood pressure, we think of somebody with high blood pressure in their body, they have to take a medicine to lower that. Pulmonary hypertension is just there's high blood pressure in your lungs. The arteries and veins in your lungs are very thick and contracted, and so the heart is beating against a very high pressure system in your lungs. The problem with that is that the blood that goes to the lungs is being sent there by the right ventricle, the right side of the heart, which is a thinner walled body of the heart. It doesn't tolerate high blood pressure very well. And what's been very interesting is in the last 5 to 7 years, we've found that the degree of pulmonary hypertension seems to be the biggest prognostic factor, other than something like a major heart disease or a major neurologic disease or a major chromosomal abnormality. Other than one of those other major genetic abnormalities, the degree of pulmonary hypertension seems to be the biggest determinant of how well the child is doing. So for example, this study separated the children into 3 groups. groups that had mild pulmonary hypertension, groups that had moderate, groups that had severe. Severe pulmonary hypertension meant that the blood pressure in the baby's lung was actually higher than the blood pressure in the rest of the body. And what they found was that babies with severe pulmonary hypertension had 100% mortality. None of them were. Babies with moderate pulmonary hypertension, they had sort of an intermediate survival. And babies with low or little pulmonary hypertension all survived. So if we can identify a gene or some sort of genetic abnormality, anomaly, some consequence that can somehow correlate with the degree of pulmonary hypertension post-operatively, that will obviously give everybody, the parents and the practitioners, more information. The other major clinical aspect that we are looking at in our study is developmental abnormality. And this is something, this is a much more long-term follow-up. When we look at pulmonary hypertension, we look at the immediate postnatal period after the baby is born. We look at the 1 month and 3 month studies, and that's pretty much it. The long-term developmental abnormalities, we're doing our studies at 2 years, but everybody knows development can take a long time. But we think the first 2 years are probably going to be the most critical. And again, we're going to try to see if there's some genetic correlation with the developmental rate. I should tell you that developmental outcomes in children with CDH is truly a black box. There's very little known about this right now. And that's one of the great things about the study is that even if we don't find a genetic cause for developmental abnormalities, this will be one of the few studies that does a very well-controlled, prospective, looking forward study of developmental consequences of diaphragmatic hernia. And I think I just wanted to echo Julia, say thank you all for coming, thank you for inviting us. And if there's any questions at all, either after the study, after the talk today, or at any time, please feel free to contact us either through our website or contact Julia at her in Columbia or at her email. As Julia mentioned, we're here afterwards. If any of you want to talk about our study or even enroll in our study, we have all the supplies we need to offer.
Does anyone have any questions? I have one. If a family lost their cherub and they had an autopsy performed and they have blood and tissue samples, can they still participate?
Definitely, yes. So anytime there's any biological samples, we'll do all the legwork to locate that. Or if you even want us to investigate whether or not there are samples remaining, we will do that investigation for you.
Would hair samples work?
Unfortunately, at this point, hair samples don't work. We don't have enough DNA from them. I don't know if, ask me that question 3 years from now and my answer will be different, but unfortunately right now.
We're trying to do it on some of the older kids, salivary studies, genetic tests you can do by giving them a little bit of spit.
Well,
And that's not quite, and that's not giving us, it's not working out as well for us as we hope. So hair probably is also, again, like Julia said, a couple years down the road, it might be a very doable thing, but right now.
We're not there yet. Give us time. We'll be caught up to